So moving on to mental disorders. Disobedience, we can put a star chart, and this chart needs to be where the child can see it, and must be the case the child knows what to do in order to get a star. Wise is not to find the child taking the stars, but to going to be generating compliance by the child who's at the same time as giving the star the need to tie stars with a material reward. However, if a tangible reward has been promised for a certain number of stars, what will follow through with this? For temporalize according to the antecedents and dissidence, behavior and consequences. Consider distraction, avoiding and dissidence, and ignoring and time. These are the ABCs. What happened in the minutes before the episode behavior, exactly what did the episode consist of, consequently what happened as a result, including what you did and the outcome. Tantrums, managing strategies, affection and tension before the data and distraction, avoiding antecedents and ignoring affected became difficult, no surrender. When parents give in to interest with them, harder to deal with over time. Time out from positive informants, walk away, returning when quietens down, separate from siblings. Holding firmly, the child is putting himself or others in danger. Star chart to prevent future episodes. Aggressive behavior. Small children can be aggressive for a host of reasons, ranging from spike to exuberance. Much aggressive behavior is learned either by being rewarded, often intermittently, or by copying. Parents subject to peer effect, recommending instances of aggressive demanding behavior provoked or intensified by a child, either peer shouting or at smacking their child. In such cases, disparate behavior that needs to change. In most instances, the same principles as by the sentences, while it make rules clear, stick to them, keep cool, do not give in, and use time out if necessary. The letter can often be used as 1, 2, 3 principle. A tired or stressed child will be irritable and prone to angry outbursts, as will children whose communication skills are compromised by deafness or developmental language disorders, so that they're frustrated, exasperated, optimistic, reassurance that the child will spontaneously grow out of the pattern of aggressive behavior is mistaken. Once established, an aggressive behavioral style is remarkably persistent over a period of years. Thus, aggressive behavior in children needs to proactively manage. There are several evidence-based parenting programs that are effective for teaching parents to manage aggression in their children. Parents should be encouraged to attend such programs. Autism and attention discover the problems of the child nocturnal and enuresis of bedwettings of immunity passage within while disabled age after which the bladder control has been usually been achieved. Infrequent bedwetting is common in children. Nocturnal is more than stop. What is the principle of time to like stop doing that, because if you don't stop, you must go to your room or prepare. Number three, go to your room. And 2 nights per week is presenting about 6% of 5 years old and 1.5% of 10 years. Boys outnumber girls by nearly 2 to 1. Achievement of nighttime dryness is dependent upon development of functionability of bladder to increase the suction capacity aided by action may be directed how much to reduce the function. Arousal of the emotion to stimulus provided by a full bladder. There is a genetically determined delay in acquiring nighttime dryness with 2/3 of children in nurseries rather than affected first usually. Young children also need reasonable freedom from stress and a measure of parental freedom in order to learn nighttime confidence. It is well recognized emotional stress can interfere and cause secondary and invasive loss of period dryness. Most children with nocturnal enuresis are psychologically normal, and treatment should relies mainly on a symptomatic approach described below, although any underlying stress, emotional, physical disorder must be addressed. Diurnal illnesses by getting data simple strength and uncommon, but causes include urinary tract infection causing fecal infection severe enough to reduce bladder volume and cause bladder neck dysfunction, polyuria from the spotting. dialysis, diabetes mellitus, renal concentrating disorders, chronic kidney disease, endometrial bladder, structural abnormalities, ectopic ureterological abnormalities. Investigation of bedwetting is only indicated the bedwetting follows a significant period of nocturnal dryness. If it occurs during the day, it is accompanied with symptoms of disrupted urgency and frequency, it clear features of UTI, vasculitis, or ill health. Anytime simultaneously considered. The management of nocturnal is straightforward but needs to be painstaking to succeed. After the age of Eve, and each was spontaneously only 5% affected children each year in practice treatment or annuities usually only started in children older than 5 years of age, with involuntary wetting during sleep at least twice a week. Explanation: the first step is explain to both child and parent that the problem is common and beyond conscious control to avoid the child feeling any degree of blame. The parents should stop punitive procedures as these are counterproductive. Fluid should be restricted in a period of at least 2 hours, even up to bedtime. Child should be encouraged to fully empty their bladder prior to going to bed. Waking or lifting during the night does not promote long-term dryness. Star chart that was praise in the star and rewarded for agreed behavior, helping to change the sheets rather than dry nights, but are treated in a matter-of-fact way. The child is not breaking. In practice, this behavior-based system is only occasionally helpful as a nurse is not under voluntary control. In this alarm, this is sensor usually placed in a child's band or in the child who sounds an alarm and becomes wet. In order to effective, the alarm must wake the child who gets out of bed, goes to pass urine, returns, and helps to remake a wet bed before going to bed. It does not necessarily reset the alarm that night. Parental help can be listed in the night using baby alarm to transmit the noise of the alarm to the spectrum. The alarm method takes several weeks to achieve dryness, but is effective in most cases so long the child is motivated and procedures followed fully. About one-third will have a few months in which the case repeat treatment with the alarm usually provide last. Just for personal synthetic and not antidiabetic, maybe usually treatment with the alarm was unsuccessful, unacceptable, or short of relief is about 4 liters of sleep. It is taken orally through intestinal after use. It may need to be continued for 3 to 6 months. Self-help supervised devices is a parental health professional area and charging more than bladder. Charity. Nocturnal common ways more than most lecture are psychologically, physically normal. Treatment usually resulted only at more than 5 years of age. Explanation here say now and just missing. Fecal swelling was persistent unexplained physical symptoms. Yeah, a common in child when there is a debate about the most appropriate terminology that validates the active symptoms to suffer. And some of the terms include function disorders, psychosomatic disorders, somatic symptom disorder, pain disorders, psychosomatic young people. Frequently experience unexplained symptoms such as abdominal pain, headache, musculoskeletal pain, fatigue, and dizziness. Most are accepted as normal body sensation, but for some symptoms lead to impairment of daily functioning. High levels of distress, poor school attendance, isolation, complacency, and use of healthcare, often with a strongly held belief by themselves on the cares that they undermine. US in childhood predicts PS in the mind-body link. Presentation management PS is based on understanding the mind-body are linked. Logically, nervous system physiology and how much recharges psychology. The mind is taught feelings, beliefs, attitudes, memories, past experiences, and personality. Familiar faces, so pain in the neck, gut feeling, heartbroken, recognize the emotional states can be associated with physical sensations. They are also objective. Physical changes such as increased heart rate with fear, excitement, facial flushing, embarrassment, tears with sadness. Physical symptoms can present when there is emotional upside, bullying, performance anxiety, or can start with illness injury. Surgery would continue beyond the expected healing period due to propagating psychosocial factors, school anxiety, lack of feeling cared for, or parent separation. Some painful conditions might be intelligible by stress. Other disease processes, eczema, psoriasis can worsen and or respond less well to treatment at times. Stress, there are also positive effects of the mind-body link and making time for enjoyable things such as hobbies, seeing friends, fresh air, exercise, mindfulness, and relaxation can all influence improve physical health. Common conditions for which there is physical and mental health overlap with chronic pain disorders, chronic fatigue syndrome, non-epileptic attacks, or postural tachycardia syndrome, non-specific abdominal pain, headache, Assessment and management history question must be asked to identify likely organic illness and address possible sources of emotional distress. The child and person should be interviewed about school, friends and family, noting the general level of anxiety, ability to communicate, interaction with parent carers. See has psychosocial screening tool person adolescent medicine. This should be an integral part of the interview. Useful routine question can include what is the best thing about school, what is the worst thing, what can provoke unexpected responses. Combining a timeline can help to identify precipitating factors, agreement of the rules, or patterns that indicate contributing factors. Symptoms that are either limited to or much worse or school days or an indicator of fun parents suggest a provoking factor. An interview with the child, young person, saying IP on the own can reveal sources of stress, especially at school, which may be unrecognized as parents or which the child young person is really mentioning. Um, that report from the school may be useful, asking all children or adolescent about their romantic or sexual relationships. Recreational activities such as drug alcohol, low mood, self-harm can be happening. Screening questionnaires for depression and anxiety can be helpful. Auto physical examination is required to reassure the child or the young person and family that there is no underlying organic cause that causes actually regain further information about the nature of the symptoms actually. Therapy is reaction to them. For example, an examiner child young person with persistent doubt is sensible to ask at the point. The journey is really the further the pain is from when life is more likely to be caused by organic biology acts. Observing the posture, mobility and behavior child young person in a clinic room and when changes during discussion or also helpful. So Rebecca and you had just started secondary school, your grandfather recently died from a heart attack. She's only child who is circulating. Her underlying asthma is normally like control of bath and occasional exercise exercise. In a physical examination recently, we noted very significant bleeding in my chest. She became frightened and was my heart attack causing further increased heart rate, certain shake and shortness of breath, subsequently she had to stop eating. Her mother kept Rebecca off school for the week, along with her less than anything after. Over the next few weeks, every time Rebecca felt slightly short of breath, she was afraid a similar attack would happen. She started to avoid physical activity, missed days from school, and therefore found it difficult. Some of them had to leave to look at her. Rebecca became more tired as she problems of surgery developed musculoskeletal. The normal blood test is successfully on whether very must be like probably presented. Repeatedly to GP asking for investigations whether they are pediatrician who with a detailed history and her physical examination reviewed the investigation, reassured Rebecca and her mother about the symptoms, explained that it was fitted into the category persistent unabated physical system POS, and suggested that child psychologist must have before the symptoms when they occurred. Husband willing to resolve the consideration and improved for the input from the child's psychologist. There is often a temptation to undertake such investigations to satisfy an action clinical child. Health professionals must be mindful that they may cause secondary harm from unnecessary medical investigation and population of illness belief. Considerable improvement sedative symptom and function can which reduce difficult communications carried with validating case suffering, removing blame, offering explanation makes sense, focusing on the words, ideas, and concerns of the tissue the child children, young person, and jointly exploring ways of managing symptoms and improving functions. Medication is really helpful in side effects, so should be avoided in favor of self-help strategies such as being putting skills, distraction, relaxation, regulating patterns, exercise, and the sleep. Hygiene, promoting communication with families around emotions can help avoid for somatic symptoms. The place where the communication with symptoms are particularly severe and disabling, affecting support system activity and to the contributing factors of factors are not easily resolved in the other professionals. Many leaders such as physiotherapists, occupational therapists, psychologists, family therapists, psychiatrists, social workers, become better. USA, a common childhood range of brain to distance, fatigue and present daily cities are usually required to ensure the child the family believe that their concerns are fully understand, addressed, and taken seriously. Maintain a solution for medical abuse measures. Regulated in May, reserve requires system for one. Takes 6 to 7 of the day knows that localization they may can be simple reform purposeful involving one of the commercial complex. However, currently purposeful involving customer risk and not entirely involuntary as they can be suppressed to some extent, though eventually can be consistent. A common number one tends to develop a tick at some stage, only on the face and head, blinking, frowning, head flipping, stiffening, throat clearing, and grunting being the most common. Boys are more common. Their average age was 80 years of takes 10 week in intensity, age 10 years. Then it takes the most likely to occur when the child is in the velocity for cause and raise or often disappear when actively concentrated. They may worsen anxiety, but they are not significant emotional reaction in many cases. There is a family. She knows children do not need treatment transient disorders clear up over the next few months. Although they may recur from time to time, they should be treated when the insurance in the first place. This commonly takes maybe multiple, although the separation from the disability takes continue for more than 12 months in considered chronic in nature, although most cases still resolve in adulthood. There are both multiple motor things and local things such as granting coughing, making said for over 1 year, then their condition of agility, large Tourette syndrome, or more simply Tourette's. Sibling is take control area to go highly publicized and present content. Personal importance of the therapeutic approach techniques. Most cases require medication through the community room under special supervision, though there is limited evidence for the beneficial effect. Antisocial behavior, children see light, disobey light fires, destroy things, and put fires for various reasons related to learning and exercise. Social shame, lack of social skills, such as ability to negotiate disagreement, they may be responding to the challenges of their peers in spite of their principal conditions. They may be chronically unacceptable. They may find their own emotion they will run the emotions such as sadness, temptation, when serious antisocial behavior which infringes the rights of others is a dominant feature of the clinical picture and is so square as to represent handicapped physical function until diagnosis of conduct disorders. Many children with conduct disorders may not have received the law, although the behavior is strong, socially discipline, quickly come from homes in which they have received the squad to observe relationship limited bound arises that of the sustained force of illusion by others and might be characterized by undefined behavior or such experiencing teachers known as oppositional, defined for the treating conduct disorders and difficult pain Parent management training programs to better strategy we have an excellent space and a highly recommended as primary interventions have a full currently population motivation can result in minimum. Where parents are willing to are unable to take up parental programs, effective training can be offered. Use of group intervention focusing on problem solving skills and management, although these interventions should be done in settings and children often do not have the level of education required to benefit in. Routine clinical settings in the absence of a coexisting set of conditions sponsored. Dedication is not considered standard for but this is an part of solving. The importance of clinical society to be decisive, we should essentially think groups are evidence-based treatment for these solving anxiety. Pathological anxiety existing to class, social journal, because there is fear of specific content, but solution that is susceptible to handicapping and cannot be dealt with reassurance. Most children have fears, fear of the dark, those can happen, the noise. Time is right, so important, and do not sleep handicapped, life. Some of these persist to adulthood. They are so slow. As a to ignore the life expectancy of the problem with the therapy quickly. Media exposure to the field event movie indicators is least successful. No diffusion is 90% in medicine trial is uncovered for childhood content. Directly bad anxiety. Often it is first manifests as physical fatigue or headache or pain. It may take several bodies and the child to the isolation that she is not going to die. Social things generalized anxiety may develop and emotional threatens actually therapy and trauma attempt to gain control over their parents and the world in general. It may be justifiable reaction to an emergency situation or be disproportionate. If the condition follows a recognizable precedent, such as parental illness, that means can be directed to provide comfort and support for most of the support if arises insidiously. Specialist mental health doctor like this indication really says spontaneously that the anxious inside the tend to complete the symptoms of the women. Apparently manipulate ways to cope with or avoid the feared situation. The communities compulsory school finance and reaction and because of parents get their child in school or because of friends in society to do something else rather than friends. Truancy, a child needs to go to school but never arrives or leaves early. It is often accompanied by the learning difficulties of few non-attendees at school, such as school refusal and ability to attend school on account of their anxiety. Such children are not completely decided because its physical concomitants as a consequence of hypermotivation. Anxiety may present as complete but not like Eyes not being well confined to weekday, term time warnings clearing up by day. May be rationalized when the child is incomplete or there is educational and underachievement. If it is disproportionate to stresses at school, it is done. School refusal anxiety probably look too more common cause, supposing that the system beyond it already has anxiety to for some aspect of school. These can coexist. School refusal based on separation anxiety of about 11 years ago for personalized events such an innocent death become from the house that is unable to tolerate separation from the figure without whom the child cannot go anywhere, including school humors aimed at gently promoting physical separation from the parents staying overnight with relatives of family arranging an early return to school. Some of the cases where school refusal have a depressive disorder, and more usually there is an interaction between anxiety disorder and also personality issues, such as intolerance of uncertainty to school phobias is seen in self over there. Anxious should be more frequently intimidated and stubborn, the rest by school refusal shown, education and achievements. Who achieve less well as that expected brought the doctor, which is important value in institutions and institutions. We show the study actually drives them. Services education psychologists are indispensable for more responsibility to consulting willing adult to accept the information according to this. Purpose considered problems of although popular image of the is one of the angry developers, which is different against unemployed in which there was a show that cause of an achievement also really healing disease. Yeah, it's a very specific cause of activity and integration. Value by economy. These are considered problem application to the most domain. Fatigue depression, dwelling against issues with short labor, unsuspected ego attendance, low sexual behavior, period of psychotic illness, and visual impairment. This is between those who have attended the drug with them about minor issues. Formal application taught the ability to form abstract thoughts, comparing implications of hypotheses, simplifying confines of thinking, and testing logic that links proposition, sequencing, location, value, data, or manual diversity matters. This is a healthy process in our environment. Home and psychological symptoms would be so social sensitivity for common as there allows one serious psychiatric problems are more to rare than family pictures are often from teenager negotiations and of their own autonomy, emergence of their own sense of themselves, and the first moves towards a personal identity. At the same time, their parents may be experiencing midlife crisis of confidence and career, physical abuse or sexuality to their gratuities or relationship outside non-obvious cognitive side of thought, especially associated with nonsense model nutritional set thought. But this is acquired at various levels by different groups including the dealership years, substantial development. Doctors have been selected for their ability to molecular abstraction and compare actions of their often foolish patients will still can concretely and practically foolish oriented in our capabilities is perhaps by the five others when interviewing their sense and state. Optimizing mind being sensitive as to their abstract and reflective to Curtis obviously practical examples of metaphors and checking that we have the so would help the to avoid the problem of being faithful others in regards to it. Questions to silent will consider anorexia nervosa and eating disorder might have conditions which lead to persistent non-negative mental some can develop an increase in house since and they complete because by not eating enough food excessive. Diminution also plays a eating a lot of food, keep binging and then trying to feel of it. Exercise, excess, diet supplements, eating disorder, healthy eating large portions of foods all at once, and then feeling sugar upset or guilty. Or as bad others was like feeling with disorder, which becomes symptoms of person's features negative disorder, body promotion. Your professional with circulation might be potentially deciding and a fear of factors within and compensatory behaviors such as restricting eating, calorie counting, avoidance of energy density, exercise, session, reducing food, reducing negative oxidative social with upset, hidden eating in front of others or big. We have a question secrecy attempts to encourage more normal eating patterns spread with conflict resistance range, eating large amounts of affect foods with sexual and most of the sexual extreme. Children and action free develop low body weight with age, medium BMI should be and have secondary and services and malaria, whereas in bulimia, city induced is common weight is weight based right for avoiding second food intake disorder is not right with body image. It is common in children and young people with new development conditions. The autism will have a very rare levels of fees and eat and noise of affection smells. Disorder eating present specific disabilities such as fear of vomiting, microphobia, and just about self thoughts about germs and food contamination. New current disorder eating have been also being described such as with orthorexia and types of food restricted because of strong inherent beliefs regarding healthy eating and muscle-oriented disordered eating is more common in boys with high level consumption Restriction on non-protein dieting, industries of protein liquid supplements, habituate people in exercise regime, and pursuit of muscle development of fitness, causes of eating disorders, social diets, smoke of less instruction, genetic, biological, behavioral, psychological, and social factors. They are similar in personality experience, persistence, and developing disorder. Players may start as a way of coping with difficult emotions of life, success, anxiety, sadness, disagreement, bullying, abuse, and parental separation. There are increased social dependence, pressure socially. Young children see these societal focus on appearance and increasing focus on food health. While some activities increase physical development, exercise, such as highlight sport, dance, and learning, they are also more ridiculous, exams, stress, description, scoring, ability to enhance to have, and everything looks indicative. No. There is emphasis on controlling or monitoring by the intake. Diabetics disease like this diet used to identify suicide diet need to achieve changes in body weight. How do you do Thanks for others, family, friends, teachers, nurses, the patients of eating disorder in relation to those above, including reductive measures that development, such weighing and examination of any body basically different invasive and getting angry or distressed when asked about eating. Some young children try to falsify their weight by thinking necessity or loading body weights on their clothing. Physical representation may be considered as malnutrition and low weight or rapid weight loss. Although the really strong with my feeling whole diet, constitution disease, and constipated, common physical signs include cold, professor, motion, bodies, color, hands, kindly movement of the body, very widely possible hypertension, dehydration, and facilitate suspect disease success. Solution 3 and 57 utilization problems elongated history of physical health include delayed puberty, significant eliminated reduced adult height, tension, and low bones density. But active and regular was associated malnutrition, infection, suicide measurements, two full medical psychological investigations, the young person and family around energy requirements, normal growth patterns. This is essential. Usually, meditation feeding is first step to stabilize the initial physical test, but as starvation alters cognitive function and properties beyond thoughts on improving body myself, within mental health, it was not affected until the refeeding process has started. Refeeding can often be achieved slowly. Family therapy teams supporting the family to in turn. Young person to reestablish sufficient eating patterns at home. Occasionally, hospitalization, cognitive supplements, and energy feeding is required. For young person diseases, this mental health can be used to retain their fertility. Some universal prolonged salvation can result in life-threatening metabolic unnecessary weakness and emotional skill and monitoring national national damage and welfare. Later, recovery individual psychological treatment is introduced to help the young children finding performations that time to treating disorders. They can make specific treating purpose should be effective in developing ways of managing time to reclaim independence with eating and maintaining good health and prevent relapse. Prognosis of eating disorders is changing. We will see many young people had a chronic course of development for the correction by the recent years of a more proactive approach to recognition and early intervention in the creative use of probably they say improve for the long treatment. Studies are needed to provide data. So eating disorder including infection of sublimia and frenzy gain presentations which is not concerns of family low body weight physically, symptoms and feel feeling tired, disease, Poor constitutional contribution segment and area size of survey, poor circulation, fine local hair of the body, posture of the machine, personal weakness, stated but emergent, musician, rehabilitation, followed psychological treatment. At least 68 has come to attention of social office when you defending. This is noticed that she is unusually thin. After arrest for shoplifting, 4 pieces not to stand, 4 pieces not provided useful. Financial information is still particularly GST flag discussion of the including a mother suggest. And negotiation around how the routine process aspect that we are to apply mitigating risk. Possibilities of committability type it is like headquarters reflection concepts. Possibility as you perceive for structure disability and certain with us and motion driver labor, very driver of defect resilience, blame self of leading, relationship with neighbor communities results, identification or alternative website, stop the body image self-growth, chronic affect the mother, exposure to liquid parent group, restriction from family, many appropriation supportive features of depression can arise secondary to in those circumstances, sometimes spontaneous depression is a clinical condition of more than sadness and medical existential motivation, judgment, ability to experience pleasure, like the whole function of guilt, and where disturbs sleep, appetite, and weight leads to social withdrawal, important signs such as state is well recognized in the relation for the living girls, but usually affects three words of children. General pictures compared with depression and unspecified differences. Diagnosis of depression depends richly upon interviewing the groups and management as well as stakeholder history and feelings. Usually, the other variety of competent to their feelings that things are all right. If interviewed and requires a necessity to ask their feelings directly and to ask SPD among suicidal ideas and plans to influence responsibility. Children why depression are managed in sleep in private care, but then asked for sleep 20 seconds. Many will recover spontaneously and as a period watchful waiting for up to 2 weeks to be appropriate. Alternatively, the child or young person will be offered non-directive support. Therapy or guided self-help, however, with mild depression does not respond to these measures into consumers or society quickly. Systematic health services. Similarly, children moderately severe depression is to be resources. Mental health services are more specific psychological interventions and cognitive behavioral therapy, family therapy, cognitive personal therapy. In all cases, any identified contributing factors such as bullying needs to be addressed. Psychological therapy for moderate or severe depressions, insufficient seeking care and SSRI, selective selection, and taking better positive should be considered. Depression, children who are suicidally may need admission to an person psychiatric patient to be shared. This is more common in because empathy, boredom, or inability to enjoy themselves rather than adjustment, separation, anxiety, which reappears having resolved in earlier life decline is socially performance social withdrawal had funded a reason to place a plain and chest of the head, creative remote of frankly, and the social build as common areas. Loss of time way processing for loss of libido, and the story of thought and movement into wisdom likeness. There is a young people basically cause themselves now for multiple reasons in multiple ways. Expression means from a coping technique for dealing with negative feelings and lower self-esteem to express this to punish themselves. Often they answer young people will describe the positive feeling that control the experience. When harming themselves, the physical climax is a distraction from emotional distress. Self-harm is common as increasing estimates of variance time. Approximately 20% of 14-year-olds have self-harm identified between females and 11% males. Many do not present their health depression actively. Therefore, no assessment of embarrassing with emotional and behavioral difficulties and complete without screening for self-harm. Common methods of self-harm include cutting, burning, biting, bruising, or scratching the skin or tying ligatures around the neck. Punching of walls should also be considered self-harm. Representation of works fractures should raise suspicion. A full physical examination and ideal time to look for signs of deliberate self-harm, cutting to get eyes, especially can often be missed. The person very not sees the level of should be especially is concerned, upper limb sign tends to be on the non-dominant line. How to ask for emergency is to remove a young person without opportunity to take on appearance that results in non-disclosure. Keeping a safe environment, allowing sufficient time to conduct the consultation sensitively without disruption, setting rules about confidentiality clearly, validating the young person distress, then assurance that they will be supported. Ask the question directly but sensitively. And there is no way to ask loss or suicide normalization of problems. Key all clinicians will find style, asking this question sometimes people are feeling politically sad or the low they have thoughts about how their websites are in their lives. As well happened to screening tools such as doctors, they assess suicide risk factors, overdose, and use long-term holistic. Most serious social illicit drugs at some stage. A number will then experiment with them. Some habitual users usually there is as an recreational purposes, but extreme use tend to avoid unpleasant feelings in that case. A very small number becomes dependent psychologically, physically. What is taken varies with culture and opportunity, but alcohol and cannabis are common. Solvents, LSDs, and ecstasies, amphetamine derivatives, somewhat less so. Cocaine or heroin currently least prevalent and addictive. Potentially the last two, the greatest, and the dangers are well known. Abuse implies heavy misuse, science vary with agent that may include intoxication, unexplained absence from home school, mixing with non-users, high rates of spending of student money, possession of the equipment required for drug use, medical complications associated with use. Patches instrument where you have probably for longer than month where you don't have so that and keep plant overdose for longer than 3 hours. Are you hopeless for the future? We're feeling sad for most of the time for the overdose. Quote one for yes. Zero for no one out to get the child at highest for more than 2 hours. Final judgment. However, the final judgment shows a risk in the clinical quantitative decision and one based on cutting score. Doctors may approach your parents for it that exponential may be using drugs. Assessment will involve interviewing their resistant positive combined with taking units up for drugs in the most geographical areas. Has specific services for adolescents with drug or alcohol problems. These services usually take self-reference so that the young people with these difficulties can access them directly. Medical involvement is predominantly focused on users who use have other psychopathological including depression with consequences of oxidation and injection when these threaten health. Solvent abuse mainly through arrested suffering is quite widespread as a group activity of young adults in some areas. It can occasionally give rise to cardiac dysrhythmias, motor suppression, renal failure. Any of these can cause death, as may a fall or road traffic accident when drugs, cannabis, and LSD use may trigger anxiety or psychotic disorders. Ecstasy taken and dances waves cause dangerous hyperthermia, dehydration, death. Doctors need to ensure that any person known to them who's thought to be using drugs knows such risk of dependence. Dependence is rare among teenagers, most likely to involve alcohol. A few who are using illicit drugs for respect from pathological. Aside from psychologists and different with psychiatric legal highs of increasing concern to clinicians. These include chemical substances produce similar effects with liquid cocaine and accessories. They can have depressive stimulant, including hallucinations, properties they easily purchase online, like retailers often legalize and sells or choice. They have been associated with a number of deaths, although the association may not be positive. The long-term effects are uncertain. Psychosis is a breakdown of the perception and understanding of reality and a lack of awareness. The person is unwell. This can affect ideas and beliefs and results. Resulting inclusion thinking where normal beliefs are held with an unshakable quality and lead to odd behavior. The connectedness and coherence of thoughts may break down. The speech is hard to follow, leading to thought disorder. Perception abnormalities lead to hallucination where perception is experienced in the absence of similar psychotic running to schizophrenia with no specific medical causes identified, and there is usually no major symptoms of mood other than blunting or flattening of affect. And bipolar affective disorder, where the psychosis is associated with lower mood, as in depression, elevation mood, or as in mania. Organic psychosis, like in delirium, substance-induced disorders in dementia. Most schizophrenia and bipolar affective disorders are rare before puberty, but increase in frequency presentation during adolescence. In these disorders, the psychotic symptoms occur in clear consciousness. Investigation should include a urine drug screen, exclusion of medication include induced psychosis, high dose stimulants, and anticholinergic drug inclusive or medical causes, infection, seizures, thyroid abnormalities, and sleep disorder, dementia. When schizophrenia, bipolar disorder is subjective urgent referral psychiatrists are needed for comprehensive assessment and treatment, like medication, psychoeducation, family therapy, and where appropriate individual therapy. In the case of an organic psychosis, the underlying cause needs to be treated probably by the pediatric team with help from mental health. Pressures of proper second present during dosing may be precipitated by or be a consequence of substance management, emotional behavioral problems, cultural consideration. Many countries are ethnically diverse in language, religion, and culture. This diversity has seen important clinical implications for child resource and mental health. The first release will need to recognize support of young people who are refugees or asylum seekers. These children and their families have often experienced major traumatic events before arriving in their host countries. They are highly vulnerable to mental and social-economic adversities due to past ongoing stressful experiences. The second challenge can add with the presentation of psychiatric symptoms. Content of sessions in children with obsessive compulsive because often shaped by the child's cultural and religious beliefs is also true of some delusion in young people with psychotic disorders, possession of religions, supernatural patients, family conditions. Understanding a child's vision can essentially look at the diagnosis. Third, there are important cultural differences about sorry, no media, excuse me. No media behavior in children with sexual faults. Help-seeking differences in the level of stigma and attached to mental illness across cultures are also influence parents' help-seeking behavior and access to child and adolescent mental health services. Cultural and race are not the same thing. Education, religion, and class all deeply affect the parenting culture of the family. It's essential to avoid making assumptions about the significance of clinical information with cultural or religious meaning, but instead to contextualize the information of the patient's consent through the use of trained interpreters. Management wanted to give you so you need to be able to understand the child's story and help them make sense of it. To do this, construct the family child or young person story that you all know about how the problem has come about. Most of the patient as a biopsychosocial formulation. Many simple but important invention will fall out of this formulation is with the young child train. The young person Ellie, you then need to use this understanding to advise them on social support and family often offer specific advice on dealing with parenting problems. Appropriate coaching is an aspect of many behavior problems related to parenting. Key principles are positivity, promoting seniority relationship through shared activities, catching them in good and noticing when they have made small positive steps is a powerful tool. Should be We did as responsibility. Promote the time that are available to the children brings responsibility. Distinguish between listening to the child, respect. In other shares of leaders, they should demonstrate swift reaction to behavior. Fostering a kind of behavior, they should say to the child, finding what you're trying to do, what you want to achieve, consider what is meaningful at the child's level, set realistic objectives like positive structure about some should be thought out and achievable. Success that truly value upon the dash attention children, make this simple and ambiguous and few, which especially target promoting behaviors consistency. Rules and expectations need to be the same across areas across time. The first place, including the appearance of separated foods, can be depending on patient's energy levels. Patient's sign behaviors can become more extreme when these strategies are put in place. Since as a professional in the module, things may get worse initially. As a professional in all these principles when the parents is level children in the end, we should embody positivity and responsibility without judgment or blame. Focus on what has been achieved, not on the final end point. These are main psychological treatment mentioned for the cause for emotional behavioral problems, explanation and formulation suitable in mind problems with good problems like hygiene for supporting families who can work out for themselves successfully approaching problem until it subsides. Counseling of child and young person is to provide non-directive, unstructured supportive therapy for children and young people and families to aid coping with difficulties that are not severe enough to require specialist psychological interventions, bereavement counseling, parents counseling, parental counseling. The aim is to enhance parental coping not by telling the parent what to do, but by helping them find their own solutions for facing the conflicts. Parenting groups are popular when parents are seen together given techniques to how to play with the children, respond effectively to each challenging behavior, various approaches to rehearse, which involve their and facilitation at the therapist. So these are behavior therapies, and pragmatic approach to problems, which alter the environmental factors of trigger behaving behaviors. It is particularly effective in the management of behavior problems in young children. Family therapy, widely used by child and person mental health professionals, is used a series of interviews with the entire household under dysfunctional patterns of relationship between family members on the basis that many child or young children people problems are persuaded by the way in which family members live with and deal with the shade. Cognitive therapy used by specialists to explore the way thinking affects feelings and behavior. It helps the young person identify challenge unhelpful thinking styles that perpetuate negative feelings of behavior. Good evidence for efficacy in a range of disorders, including depressions, and mutual or appropriate of time and psychotherapy, more structurally intense exertion of counseling, which can help children and young people who, for example, have unconscious conflicts which are manifest as a relationship difficulties is appearing counseling instead of psychotherapy. It is now as commonly used. Other treatment interventions are given and these interventions may general practitioner, pediatrician, other doctors are good journalists in childhood and mental health specialists should be seen as a specialist extension of their expertise rather than a completely different sort of person. Main treatment intervention and approach to manipulating display. As the management of children emotional behavior should be psychological rather than pharmacological, does not mean the child development to have found a surprise for suitable. The city was resolution of a child protection involves there's a ski participants may know a variety of services, social services, often more than one, pressures required to treatment of combined and sudden pressure with them. Medications play comparatively small role Although particular instances for which there is evidence for the efficacy are the use of similar technology in the drugs radiation will cycles and 90% of sedative devices. Since there is sometimes temptation to sedate a child who is causing a problem with really effective and ethically question. Very good. Simple one for child this age, yes or no? Yes, why is it contained? Incomplete considerations for reason for concerns and effect is normal reaction stressor, no and yes. Explain your device, if you don't have emotion itself, no or yes, conflict pains, the child and behavior program meditation. If no, if you're going to do the for the meditation, child psychiatrist and also social service and energy. So this is the end. Problem next we're doing. Yeah. Thank you very much.